In this video, I'm going to show you how to use eye drops properly. Many of my patients every day use eye drops on a regular basis, and if you end up missing and it just ends up on the eyelid, then you end up wasting your precious eye drops. So I'm going to walk you through the proper steps on how to use eye drops, and I'll share some pro tips that'll make it a lot easier and may even save you some money. Plus, if you're somebody who blinks a lot or flinches due to the eye drops coming in, or maybe you have a child who can't stand using eye drops, then I'll even share a smart way to getting eye drops in, even with the eyes closed. Now let's take a look. Hello and welcome, this is Dr. Alan here from the Dr. Eye Health Show, helping you with the best tips and education all about the eyes and vision. If you're new here to the channel and you like learning about the eyes, seeing your best, then consider hitting that subscribe button down below and ringing the bell so that you don't miss any of my future videos. And this video is part of a complete series all about eye drops, whether you're looking for the best eye drops for dry eyes, red eyes, or itchy eyes. If you want to check out the full series, I'll put a link to that in the video description below so you can find it easily. Now let's go over how to apply eye drops easily and without missing. Step one is to always wash your hands. You're going to be touching around your eyes and you don't want to possibly give yourself an infection. Step two is to check the side of the bottle or the box for an expiration date. If it is expired, then it's best not to use it, otherwise the active ingredients aren't going to be working and you end up just getting more side effects and possibly cause a burn or irritation to the eye. Step 3 is going to be shaking the bottle for about 10 seconds. That's going to mix around the ingredients and improve the effectiveness of many eye drop medications. Now step 4 is to remove the cap of the bottle and place the cap on a clean surface, such as a clean tissue paper or paper towel, someplace where it's not going to contaminate the top. Plus, a pro tip here is to observe the tip of the bottle for any coloration change, because that could be a sign of contamination and you don't want to be using those drops. Now step 5 here is going to be really important, and that is to use your fingertips to hold down the lower eyelid that you're going to be administering the drops in. I prefer to use my non-dominant hand to hold that lower eyelid down, and that creates a little pocket that essentially increases the target size for the eye drops to get in the eye. And it's usually best to get your fingertips right to the eyelid margin, as that's going to create a larger eyelid pocket. And now step 6 is while you're holding your lower eyelid down, you're going to lift your chin and your gaze up toward the ceiling. And with your dominant hand holding the eyedropper, you're going to place a single eye drop into the eye. Now it's important not to touch the dropper to the eye or the eyelid, because that could cause a contamination to the dropper. And another pro tip is to not free float your arm up in the air, because then it's going to be harder for you to hit that target of your eye. Instead, what I like to do is rest my dominant hand on the back of the hand that's holding the eyelid. That way I can position it just at the right height. And another key and important pro tip here is to only use a single drop at a time. Using more drops than one isn't going to improve the effectiveness of the drop. Instead, it's just going to waste the drops and it may increase your chances of side effects. Step 7 is that after you've gotten the eye drop in, try to keep your eyelids closed without blinking. Keeping the eyelids closed will keep that medication to the eye and improve its effectiveness. If you blink several times, all that's going to happen is going to flush those drops through the drainage canal of the eye down to your nasal cavity. And a pro tip here is that you can even do punctal occlusion, where you use your fingers to block the drainage canals of the eye. If you feel right between your nose, you can feel these little bumps right there. That's the drainage canal. And so if you block that for about those 30 seconds with your eyelids closed, that's going to further reduce any of the drainage of those drops through the drainage canal, and even helps prevent systemic absorption and potential side effects. After that, you can wipe away any excess drops from your eyelid with a clean tissue and then recap your bottle. Now, if you happen to be someone who has a really hard time getting eye drops in because you're always blinking or flinching, or maybe you have a young child who has a hard time with eye drops, there is a smart way of how to put in eye drops without flinching. So let's go over that now. Now, in the eye clinic, if somebody's having a hard time getting drops in, we usually ask them to close their eyes so that way they don't have to see the drop coming toward them, and then they look up toward the ceiling. You can alternatively also do this while laying down. And then you can either put the drop in yourself or have a friend do it, but you're going to put a single drop right into the corner of the eye by your nose. Once the eye drop is in the corner, you simply open your eyes and then you will feel the eye drop apply itself to the surface of the entire eye. After that, you can then again close your eyes and punctal occlude for about 30 seconds. If you are applying the eye drop to yourself in this manner, it's important to first align the eye drops over the eye so you get it in the correct position and not onto your eyelid. A cool way you can do that is to just rest the bottle slightly on the bridge of your nose so you can actually see the front edge of the tip. And then you just tilt it slightly down, close your eyes, and the drop should fall right in. Now, there's a few extra pro tips about eye drops that I wanted to share just because I believe they're going to help you out. The first one is that if you are using multiple different eye drop medications, you want to space those out by about 5 to 10 minutes. Otherwise, if you use too many at a time, you could end up flushing out the previous eye drop. In addition, if you happen to be using any eye drop gels or ointments, make sure to use those last. Otherwise, eye drops that you could be putting in, if you put them in after you put in a gel or ointment, the gel and ointment's just too thick and the drop's not going to get through. Now, if you happen to be a contact lens wearer like myself, it is always best to take out those contact lenses first before putting in any eye drops, unless you were specifically told to do so by your eye doctor. They do make re-wetting drops specifically for contact lenses that you can use while you're wearing your contacts. If you want to check out some of my favorite eye drops that work with contact lenses, I have a video on that, and I'll put a link up to that here in the YouTube card above, as well as in the video description below, again, so you can find it easily. Another cool tip is that if you're somebody who's just not ever sure if you got the drop into your eye, then you can try refrigerating those eye drops, because that'll give it kind of a cooling effect and make it more obvious when you've gotten it in. If you're not sure if your eye drop can be refrigerated, always just ask your eye care provider or your pharmacist for more information. Now, another cool thing I've been sharing is that of Nano Dropper. This is a special topper that screws onto your eye drops and reduces the amount of liquid coming out of the dropper by up to 70%. This is really important, I think, for anybody who uses eye drops on a regular basis, like day to day, especially for someone with glaucoma whose medications can get quite expensive. With Nano Dropper, you still get the same effectiveness of your eye drop, you just are reducing the waste by up to 70%. Which can ultimately save you a lot of money on your eye drop medications. If you want to check out Nano Dropper yourself, I'll put a link to their website in the video description below. Plus, you can save 10% by using the discount code ALLEN10 at checkout for your first order. Nano Dropper is not sponsoring this video, and I do not receive commission off of that. They're just really cool and are offering this discount for my viewers. So I hope you learned something new from today's video. If you did, smash that like button for me and drop a comment below of which part of the video helped you out the most. If you'd like to learn more about the best eye drops for dry eyes, red eyes, or itchy eyes, check out the video series right over here to the side by clicking and tapping the screen. Otherwise, again, this is Dr. Allen. Keep an eye on it, and we'll talk to you soon.